Okay, my baby is crying. My baby is crying. My newborn is crying. Okay, babies cries a lot. It is what they do. But if your baby cries non-stop for more than 3 hours a day, at least 3 days a week, they may have a colic. A colic baby is non-consolable, and there is often nothing you can do to calm them down. If your baby has colic and you are feeling overwhelmed, it is important you seek help. Hey guys, welcome and welcome back to another video. So guys, if you have not subscribed to my channel, kindly subscribe, like the video, share, comment. Don't forget to turn your notification bell so that every time I post a video, you will be the first person to be notified. So let's talk about colic in this video, so that we know what we can do to help our babies, what are the reasons, or what causes colic, and why most babies or most newborn can cry throughout, or maybe they've said 3 days in a week. So stay tuned, watch this video up to the end, and let's enjoy. Colic means you otherwise a healthy baby cries excessively or for no apparent reason. Healthcare provider define colic as intense crying for more than 3 hours a day, at least 3 days a week for more than 3 weeks. Often, there are nothing you can do to relieve your baby from crying. So all baby cry. It is the way they communicate their needs. But a colic baby is non-consolable and seems without and I mean they creams without any obvious cause. So the crying usually starts suddenly at about the same time every day, often in the afternoon or in the evening hours. However, when your baby is not crying, they act completely normal. While colic in babies is harmless and passes quickly, the condition can be frustrating for parents. Managing a baby's colic only add to the stress and fatigue a newborn parenthood. What am I saying? Managing baby's colic only adds to the stress and fatigue of the new parenthood. Researchers have linked the condition to postpartum depression and shaken baby syndrome. Therefore, if your baby cries, if your baby has colic, it is important to reach out for help if you need it. So, let's talk about when does the colic start. Colic typically start within first few weeks after birth. It peaks between 4 to 6 weeks of age. Then it is usually end rather abruptly when your baby is about 3 to 4 months old. Let's talk about another thing again. How common is colic? Colic is very common condition in newborn, and it affects about 20% of babies worldwide. Although some studies suggest that the rate is often higher. Infant colic is the reason for 10% or 20% of pediatrician visits during the early weeks of a baby's life. So colic affect all babies equally, regardless of the gender, regardless of ethnicity, regardless of socioeconomic status, regardless of feeding preference, or regardless of birth order. So, what are the symptoms or signs of colic? Let's talk about that. Colic babies are healthy infants who have repeated period of inconsolable crying without any apparent reason. So these crying episodes last for hours without stopping. Symptoms of colic in babies can vary. Colic babies usually get fushy at the end of the day, but crying can happen at any time. Your baby can be difficult to comfort during this stressful time. There are no link between this period of fushiness and hunger or discomfort. Although your baby is fushy and cries, they continue to eat well and gain weight. So let's talk about the symptoms or the signs. Where your baby might have clutched feet, legs curled, up over their tummy. They can have arched back, hard and swollen abdomen. They might pass gas, painful look on their face. They might present that. Face turning bright red or deeper shade after a long period of crying. Let's talk about what causes colic. Researchers don't know exact reason why babies get colic. So there are, however, several factors that may play a role, and they include abdominal pain, abdominal pain or discomfort from gas, or we can say air swallowed during nursing or crying. They can be caused by reflux or bringing up of stomach content. They can be caused by food allergies. They can be caused by milk protein intolerance. They can be caused by underfeeding or overfeeding. They can be caused by overstimulation. They can be caused by... So we were talking about what causes what causes colic, and we said some of the things which can cause colic are overstimulation. I've already talked about that. An early form of migraine or headache, emotional reaction to frustration, fear, or excitement, and also it can be caused by underdevelopment of digestive system. Let's talk about what are the complications of colic. What are the complications of colic? Colic can take a toll on new and old parents alike. The overwhelming stress that colic can place on caregiver can lead to postpartum depression and shaken the baby syndrome. No matter how impatient or angry you become, you should never shake your baby. We know very well that shaking infant can cause blindness, brain damage, or even death. Let your healthcare provider know if you are having feelings of depression or having trouble dealing with your emotions, as they can recommend ways to help. So if your baby has colic and you feel overwhelmed, reach out to a trusted friend, family members, or healthcare provider for help. Okay? About the diagnosis or test, how do I know if my baby has colic? You can usually diagnose colic based on the pattern of symptoms. It helps. It will help if you keep. It will help if you keep a record of when your baby crying, spell, occur, when your baby sleeps, when your baby eats, and how often you okay, and also maybe your baby's pattern of bowel movement. Your baby's healthcare provider may perform a physical exam to rule out physical conditions such as esophageal reflux, an infection, or an allergy, and also as the cause, or maybe if those are the causes of colic. About the management and treatment of colic, how colic can be treated, there are no cure, or there is no cure, but there are steps you can take to soothe a colic baby. You may try the following baby, the following, what I'm going to say, of course. Feed your baby. About the feeding the baby, don't overfeed the baby. Don't feed the baby when the baby is lying. If the baby is breastfeeding, or if you are breastfeeding your baby, keep track of all the food and drinks you consume. Food, how do you call it? Food journal. And also you may have to eliminate milk product, caffeine, chocolates, nuts, onion, cabbage, or any other potential irritating food from your diet, because what you eat is what your baby will eat. Yeah. Another funny thing about, you see, if you eat something and you pass a gas, the way that gas smell, or the way if you pass a gas, I mean, if you pass flatulence, that is the right word. The way your gas smell is the same way your baby's gas will smell. So what you eat is what your baby will breastfeed. So you must watch things you are eating when you are breastfeeding the baby, so that you avoid this irritation, because you know the baby has not, sometimes they are not used to some of the things that you're eating. So also, if you are feeding your baby formula, or if you are feeding using the baby formula, you may want to try different brand. Infant can be sensitive to a certain protein or proteins in formula. So talk to your healthcare provider or your pediatrician to give you the right brand for your baby, yeah, or to recommend you. Also, another thing that you can do, comforting your baby, ways that can help your colic baby include skin to skin contact. Skin to skin contact, this one I've seen working. Rocking, either in a rocking chair or in your arms as you sway from side to side. Don't shake the baby. Also, gentle stroke your baby's head. You can stroke your baby's head or pat their back or chest. Also, you can sing, or you can talk to them, play soft music for them, walk with them in your arms or stroller, ride the car with them. Also, you can have some vibration or noise around them that can distract them. Bump them to relieve any trapping gas. Warm bath can help decrease stimulation, and also you can use pacifier. Some breast feed babies will actively refuse it. It can provide instant relief for all. or for babies who are not breastfeeding. But if you're breastfeeding the baby, like this one doesn't like pacifier, and I don't use pacifier because my babies, they don't like pacifier, because you know I breastfeed the baby for at least exclusive breastfeeding for at least 6 months, unless I'm going to work, maybe at least for 3 months. So about the prevention, maybe you might ask if the colic baby or colic can be prevented. Scientific or scientists, okay, scientists are not sure what exactly causes the colic, so there are no way to prevent it. You can only do those things that I've said to calm your baby. Yeah. About how long does colic last? We've said that they start few weeks after giving birth, and they will last up to 3 to 4 months, depending on your baby, or depending on different types of colics. So let's stop from there. Let's meet in the next video. We are going to talk about all these things that usually can cause depression when you are during postpartum, yeah, or after giving birth. So in the next video, we're going to talk about, maybe we had already talked about hiccup. Now today we have talked about colic. Now again we will talk about false teeth and false teeth. I think that is the next video. So I hope you enjoyed this video. Make a comment or write a comment. Tell me what, or ask any question about newborn. I will answer them. So bye till next time.